talking to us from Whangārei. Lovely to see you, Gary.
Nice to be here, Bernard. How are you doing?
Great. I'm obviously a huge fan of Substack, and I love how you've used Substack to bring issues to life in a vibrant and a very detailed way. And you've put out a Substack post today about the government's decision announced yesterday to create a brand new medical school to train doctors in Hamilton, attached in theory to Waikato University. Waikato Hospital and the university. Gary, what did you think when you first saw this announcement?
Well, we've been hearing about this for a couple years now, because I don't know if your listeners know this, but there was a bit of a leak and a bit of a problem years ago for Shane Reti and Neil Quigley, I think, who was the vice chancellor of the University of Waikato, because Mr. Quigley said words to the effect of, this is a gift or a present to National Party in advance of them winning the election. And that took a lot of people aback. They said, how was this not a public conversation? Why wasn't there discussion about this? Who said we decided on a third med school? So it looked like it was already a made decision. And then there were a couple of years of sort of a gap, and now it's been sort of thrust out there again. It will be happening, they say, but they say it'll be in 2028. And yeah, I have my thoughts on it. I think there was when government is saying it doesn't have enough money to help people feed themselves or house themselves or educate themselves, it's an ironic time to be building a new medical school. So if your family was growing and you didn't have a lot of cash, you probably wouldn't have a new build. You might get a sleep out or extend the home you have. And there was a PwC report a couple of years ago that looked at what was the cost of extending University of Auckland and Otago. They could take 200 to 300 students, so more than the 120 that the entering class will have in Hamilton. And they could do it for a cost-effective fee because they weren't building new infrastructure, right? It's obviously very expensive to break new ground and build a huge edifice. So it just begs some questions of, if we had two options there of just extending what we already have, it would have come online a year sooner than this current third med school proposal. And arguably more faster, more efficient, and more cost effective. So yeah, it doesn't make a perfect sense to us unless there's something more to the story, perhaps.
Yeah, because they seem to have cut their costs from an initial cost of $380 million. And the announcement yesterday was that somehow there was going to be a reduction in that cost of to around $235 million, and that the University of Waikato and some unnamed philanthropists were going to come up with a lot more of the money. What struck me, though, was the who's going to pay for the buildings, but also how is it going to fit together with the hospital, which is already bursting at the seams? Because you can't just have doctors and train them up with laptops. You have to throw them into a hospital, I'm guessing.
Yeah, that's really the most fascinating piece in all of this, which is, where are the doctors going to come from to staff up this medical school? Because we know that nationally we lack probably 2,000 to 3,000 doctors, both primary care and specialists, perhaps more. We know that there's just awful understaffing. So nationwide, hospitals basically are telling us in the media and with numerous reports that they are between 15 and in some cases 45% understaffed. So those hospitals, which is the vast majority of them, are saying, we actually don't have time to teach medical students. We are having to provision more and more clinical care. So, you're being told to see more patients and run more clinics. And it's hard to actually find any spare time to teach medical students. So then it becomes an interesting question of how University of Waikato is going to provision all of these staff? Where are they coming from? There was no simultaneous announcement that they would be staffing doctors and nurses adequately within the public system. So it just begs the question of is this a fully formed plan, or is this an infrastructure announcement?
Yeah, because the government has talked quite a big game in the last year about bringing in international investment into public facilities in the form of public-private partnerships. And if you don't want to put your own capital into a whole bunch of concrete and steel and maintaining it, you can get the private sector to do it, which sounds great on the face of it. But typically the costs of doing that are significantly higher because the interest costs that a private organisation has to pay for its debt is about double what the cost is for the government. And over time, that private company that's running the building will want to make a significant profit and have track records of doing so. And therefore, the cost of running it will also be significantly more. And therefore, that's money that can't be used to pay for doctors and nurses and all the staff and facilities in a public hospital. What do you think of this general shift towards public-private partnerships? Because on the face of it, the government says this is the perfect solution. We can get what we need and we don't have to use our money for it. We can have lower interest rates, less government debt. That's a good thing. What's the problem with PPPs?
The problem internationally has been that it's the public that's left holding the bag. Often, if there's a default or a cost overrun, or in the case of hospitals, some understaffing and some deaths, there often is the state actually stepping in and being sunk with a lot more cost than they ever planned at the beginning. The question with any public-private partnership is, what is their pound of flesh that they're extracting? And these are complex deals. And it's very easy for the public to be on the losing side of that deal. And I think with healthcare, it's an even more dangerous place for PPPs, private-public partnerships, because the profit motive is to maximize profits. And if you put that against the health and welfare of patients, I think most of us would understand that there's a very natural conflict of interest there, right? If I can make a little bit more money for my corporation by providing you with a little bit less care, with being a little less transparent, with not reporting problems with the same robustness as the public sector, and these are all things that have been well proven in international experience. In fact, there's an interesting story out of New South Wales. Joe Massa, 2-year-old toddler, a very notorious death at Northern Beaches Hospital in Australia. And that was a groundbreaking and extensive public-private partnership. And it turned out as worse than you can imagine, to the point where the New South Wales government a couple months ago announced Joe's Law. They said we would never again allow the private profit motive, so public-private partnerships, to own and run our hospitals, our acute care hospitals. Because, again, there's just a huge conflict between profiting from patients' suffering and helping them. Like, it's just the two are kind of set in opposition in a PPP. And it's scary when you hear that PPPs are making their way in more and more and more. There are people who say we will become renters in our own land. And you know that the next generation may be saddled with debts and liabilities that were unforeseen now. I think it should fill people with worry and caution when they hear that, I think it was David Seymour got the amount of money, public money, to be cut by a third for this medical school, cut to a level at which that it's unlikely they could actually make a medical school for that little, for 82 million plus 150 in donations and university funds. Doesn't make any sense in the days when even a simple public hospital is well over $1 million. So quite curious how this will all turn out. If we want to be cynical, we could say it'll turn out well with great profits for the private sector, because in general, that's what happens.
So what's your proposal to improve things? Because obviously we're understaffed, underfunded, infrastructure is not being maintained. It's been growing at much slower rates than population growth. We've got an aging population, in many ways a sicker population because of rising obesity rates and problems with mental health. So, what can we do to do a better job?
Well,
The government says
the first step I think we can do is to not pretend that privatization is going to take care of the health needs of the public. It is there to maximize profits. Yes, it will cherry pick the healthiest, most profitable cases and patients. It will ignore the least profitable, most sick ones, and it will hollow out the public sector so that after this first tranche of private surgeries get done, you will look back a year from now at the public sector and say, wait, I need the public sector now. Where did my anesthetist go? And we know anesthetists are among the highest numbers of doctors or rates of doctors that are leaving for private. And as government is putting hundreds of millions of dollars out there of public taxpayer money to the private sector, will attract surgeons, proceduralists, endoscopists, nurses, and anesthetists, and many other specialists. And that's a one-way street. When you go back to the public hospital, it will be more hollowed out. You say, what's the answer? The answer is quite straightforward. I don't think we need to invent new infrastructure and build it and they will come. We don't need a grand plan. We've been telling governments that we need to staff the public sector adequately. So here's a simple, you want a simple solution? Some people might call it simplistic, but with no community discussion and under great haste and some level of secrecy, government has set aside $2.9 billion a year to help property investors, so landlords, afford their mortgages a little more easily. So they get a benefit on their mortgage interest that primary first homeowners do not get. If we literally just reverse that, which that was a law that did not need to happen, but it was through the generosity of government that they decided to help landlords. If they just today choose to reverse that, that $2.9 billion would cover every doctor and nurse vacancy in the country immediately, and it would pay for free dental care for every New Zealander. So these are decisions we make. I don't want us to pretend that we're backed into a corner and there's nothing to be done. We got into this situation because of bad decisions and certain priorities that didn't put the public first. And we can get out of this problem by putting the public first.
Gary, thank you very much. Dr. Gary Payinda talking to us from Whangārei, and I'll make sure there's a link to his excellent Substack in the show notes. Gary, thank you so much for spending the time today.
My pleasure, and thank you for the work you do. Appreciate it.
Cheers.